Well, welcome to our second episode of this podcast, Healthy Perspectives with Dr. Bruce Vanderhoff. And our topic today is something that I think is not only important, but it's timely as we're moving through summer and beginning to look forward to the new school year, and that is child and adolescent vaccinations. And I'm really pleased for this episode to welcome our guest, Dr. Robert Frenck, a pediatrician and director of the Vaccine Research Center at Cincinnati Children's Hospital. So, welcome, Dr. Frenck.
Well, thank you for having me.
We're really pleased to have you. Hey, I wonder if you might share just a little bit about your background in pediatrics,
Sure.
including how you developed special expertise in vaccines and became involved in the whole vaccine sphere.
Happy to do that. So I actually went to medical school on a scholarship with the U.S. Navy and was in the Navy for 27 years before joining Cincinnati Children's Hospital. And while in the Navy, I did a pediatric residency and then specialized training in pediatric infectious diseases, a fellowship in infectious diseases. And I really enjoy very much being a physician, taking care of patients. But one of the things that I found is that as I was taking care of patients, I'm taking care of one family, one child at a time. Whereas with public health and with vaccines, you have the opportunity to really improve the health of a community or the country or the world. And that's where I became interested in vaccines because I really saw that they had the opportunity to provide significant health for large populations.
Yeah. And that's interesting because I can see so many parallels with my own career as a family doc. I really found that while I thoroughly enjoy taking care of patients in the office and in the hospital, what public health has enabled me to do is reach further, right, and be able to work with whole communities. So it's really a great thing. So let's talk a little bit more about child and adolescent vaccines. And I think before we do, I think some background for our listeners is in order. So I'll start with that. In Ohio, students entering kindergarten through the 12th grade are required to be vaccinated against several childhood diseases. Specifically, we require that they be fully immunized against diphtheria, tetanus, and pertussis, which of course is whooping cough. And for the listeners, that's usually one vaccine. They're also required to be immunized against polio, measles, mumps, rubella, usually grouped into another vaccine, and then hepatitis and chickenpox. And then additionally, once they get into the adolescent years, our seventh graders need a tetanus, diphtheria, pertussis booster, as well as the meningococcal vaccine, which then in turn in the 12th grade, they're required to have that updated. So that's sort of the list of required vaccines in Ohio. There are exemptions. Ohio law allows for exemptions from required vaccinations for medical reasons or for reasons of conscience, which of course would include religious convictions. But what we've seen is that the percentage of our students who are meeting all of these requirements at the kindergarten timeframe, so that's when most of them are due by, the DTaP, polio, MMR, hepatitis B, chickenpox, we're seeing those rates really slip. So I'll just throw out some numbers here. For the Ohio students entering kindergarten who met all of their vaccine requirements, we've seen that number drop from around 90% in 2019-2020 school year, so the school year sort of at the beginning of the pandemic, down to in the 24-25 school year, so the one that just completed, we saw that number drop to just over 85%. So that's a drop of nearly 5% over the past 5 years. And interestingly, we also see that the kindergartners who have a listed reason of conscience or religious objection has grown from 2.6% to 4.5%. And of course, this is in a larger context. We've seen these vaccination rates fall nationally as well. So it's not just an Ohio phenomenon. There's been a real decline, it appears, in vaccine confidence. So what are you seeing in your clinical practice down there in Cincinnati, and what are you hearing from your colleagues about this whole issue of parents and their confidence in vaccinations for their kids?
Well, I think one of the things is that people need to understand is that vaccines are incredibly effective. They're very well tested. There's been some things raised lately about being tested against placebo. Every new vaccine has always been tested against a placebo, and we also tested against the vaccines that are already available to make sure that we're not doing anything that interacts with the vaccines that are already available. So it's very well tested and shown to be safe and effective. The thing is that what happens, though, is that the vaccines have been so effective that parents don't realize that these diseases still exist in large measures. So parents want to do what's the right thing for their kids. They want to keep their kids safe. They want to keep their kids healthy. And I think a lot of times they just don't realize how important the vaccines are. And that's what we have seen over and over again is whenever vaccine rates drop, we have outbreaks. It's not if we're going to have an outbreak, it's when we're going to have an outbreak. So we've had outbreaks of measles, we've had outbreaks of pertussis, we've had outbreaks of mumps. Whenever we have our vaccination rates drop, we have outbreaks. And that, as a infectious disease physician and public health doctor and stuff like that, I want to keep kids healthy. I don't want to treat them when they're sick. I'd much prefer to keep them healthy so I don't have to treat them when they're sick. And that's what vaccines do, is they keep you healthy. They keep you from getting sick. And that's why they're so important. And they not only keep you healthy, they keep you from transmitting the infection to other people.
Yeah. Relevant to that is I just saw a report yesterday from the CDC indicating that in the current measles outbreak here in the United States, we have actually crossed the threshold of having more cases than we've ever seen since the widespread introduction of the MMR vaccine, which is disappointing, right? You look at the impact, well over 1,200 cases in 37 states. Ohio hasn't been spared. We've had 35 cases. And you look at this, and nearly all these people are unvaccinated or have unknown vaccine status, or presumably unvaccinated. And the impact is very, very real. I think you're right. People have forgotten that many of these diseases, including measles, are nasty diseases.
Yeah.
People get hospitalized, people die.
Yeah. That's the thing as far as that. A lot of times people say, they're just childhood diseases. And that, if you look at in 1900, which wasn't that long ago, 125 years ago, 1 out of 5 children in the United States died before their 5th birthday. That's almost incomprehensible to think of today. But 20% of kids died before their 5th birthday. And the leading causes of death in the United States in children were diphtheria, tuberculosis, diarrheal diseases, pneumonia, things that we hardly see in the United States anymore. And that's because of the vaccines. And, you mentioned about measles specifically, is that, most kids do okay with measles, but we don't know who are the ones going to be sick. And that if you get measles, about 15% of kids end up needing to be hospitalized. And even worse is that you can have permanent brain damage, you can have blindness, and as you mentioned, you can even die. But, so it's not just it's just a little cold or something like that. This is really a very serious illness, and that people just don't know, and that's good that they don't know, because the vaccines are being so effective. We don't want people to find out again, and by having their kid get the disease, we want to keep them healthy and keep them from not getting the disease.
I can remember my dad has more than once told me the stories about the polio vaccine, and kind of the fear that people experienced in neighborhoods when there would be a case of polio that would show up, and how just eager everyone was to get that polio vaccine when it became available. It was a very positive change, and just got rid of something that caused really great dread and fear. And of course, you may have, I certainly have had colleagues who had polio and had lifelong disabilities as a result of their experience with polio. So,
Senator McConnell had polio as
yeah,
well.
yeah. Okay, so that kind of brings me then to the issue that you've sort of touched on, and is particularly poignant, I think, with the measles, mumps, rubella vaccine, the MMR, but we've seen this concern with really all the vaccines of late, and that is vaccine safety. And you were referencing a little bit about that, but let's talk a little bit more about that. Can you sort of dive a little bit deeper into? Look, we've heard that they're now, of course, very debunked information that's been out there about the MMR vaccine and autism. There are all kinds of anxieties about, vaccines causing a host of concerns for people. Vaccine safety. Can you talk a little bit more about that, including, I think people aren't necessarily aware that there are ongoing programs for monitoring vaccine safety and vaccine impact. So talk a little bit more about both the process that any vaccine has to go through in its development, and then how we watch it carefully thereon.
So, it's a very, very rigorous and well-controlled process. And we go through multiple stages of testing, and that the overarching theme for all our testing is safety, to make sure that the vaccine is safe. And then the next thing we're looking at is how good of an immune response it gets. And then as we're getting information there, then we go on to what's called an efficacy study to see how well it prevents disease. And that each new vaccine goes through this process. And as we introduce a new vaccine, what we do is that we compare initially, when we don't have something licensed for, let's just say we didn't have a pertussis vaccine, a whooping cough vaccine. When you first would introduce that or do the testing, you would have some children get the vaccine and some children get placebo. And the reason you do that is because that's the only way that you can really tell how well the vaccine is preventing from getting the disease. But once you have an approved vaccine, so let's say pneumococcus now, which can be a very serious bacterial infection. Once you have an approved vaccine, then any vaccines that are improvements about that or modifications that you test that against the currently licensed vaccine, because you already know that currently licensed vaccine is effective, and you wouldn't want to expose children with a placebo. Because if you gave them placebo, when you have a vaccine that works, you'd actually be giving those children a risk of getting a disease that we know that we can prevent. So it's really unethical to do a placebo trial once you have an approved vaccine that's shown to be effective against that disease. But initially we do placebo-controlled trials on all our new vaccines. And then once we have that individual vaccine, then we test it in conjunction with all the other currently approved vaccines, because we want to make sure it doesn't affect the immune response to the vaccines we currently have, because that wouldn't be good, as if we added a new vaccine, but it adversely affected the vaccines we already have. Then all that information is submitted to the FDA, the Food and Drug Administration, and they review it all, and they decide whether or not the vaccine is appropriate for licensure. And then after there's a licensure, then the information goes to the ACIP, which is the Advisory Committee for Immunization Practices, and they provide recommendations for use. So there's the two different things. There's the FDA that's licensing, and then the ACIP is making recommendations for use. The Family Practice Association and also the Academy of Pediatrics also provide recommendations for use, but they harmonize those with the ACIP so that we're giving one recommendation throughout the country. And then after the vaccines are approved and recommended, there's ongoing surveillance. There's what's called VAERS, which is the Vaccine Adverse Event Reporting System, where people can write in, and anyone can do that. It doesn't have to be a doctor or a healthcare professional. Anyone can submit a notice to VAERS and say that we think there's been a vaccine-related problem, and that if the CDC then is getting a signal to say that, oh, we've had, like, say, with a vaccine that you had with the rotavirus vaccine we had in the past, where there was this unusual disease or illness called intussusception. They were getting a signal, and then they said, ooh, we better look at that, and they did what's called the Vaccine Safety Data Monitoring Group. So then they actively look to see, does this event seem to be caused by the vaccine? And they found actually that one, the intussusception, looked to be caused by the rotavirus vaccine. So that vaccine was actually removed from our schedule, and we had to go back and develop new rotavirus vaccines, which are safe and effective and don't have that problem with the intussusception. So there's ongoing continuous monitoring even after the vaccines are approved, and that goes for the life of the vaccine. It doesn't just stop after a year or two. It's there forever.
Yeah, and of course, there is no such thing as any therapeutic intervention, whether it's a medicine, a vaccine, a surgery, a procedure of any kind, that doesn't carry with it any kind of risk or any potential for an adverse effect. So what, just to give parents sort of a sense of this, for the approved vaccines, those that the ACIP has recommended for children and adolescents, what should parents think about in terms of the known level of risk, for vaccines? How common are these serious side effects?
So the serious side effects are very, very unusual. Basically, the side effects that we see with the vaccines is that, and because most of them are shots, is that it hurts, right? I mean, you give somebody a shot, you're putting a needle in their skin, that hurts. But it's a short period of time. You sometimes get some redness around there, sometimes you get some swelling around there. But those are really by far and away the most common kind of side effects. Sometimes you can have a little bit of muscle ache, joint ache for a day or so. Sometimes you just feel a little bit blah for a day or so. But those are really the common kind of things. One of the things that you had mentioned is that there was this concern about autism, and that what was said was that the measles vaccine was causing autism. And that's really been shown in multiple studies that it doesn't cause autism. And one of the ways that we have to do that is we have to look at children that receive the measles vaccine and then what their rate of autism is, and then the children that didn't receive vaccine. So you were mentioning 95% of kids in the United States get measles vaccine, but that leaves about 5% of the children that didn't get measles vaccine. And so what we could do is to look at what the rate of autism was in the kids that got measles vaccine versus the rate of autism in the children that did not get measles vaccine. And guess what? It was identical. It was exactly the same. So that shows you that the measles vaccine had nothing to do with the autism, because if it did, then there would be a higher rate of autism in the children that got measles vaccine. What you see is an association. And association means two things happen at the same time. And so what that means is that, like, if you give something to 100% of the people, it's going to be associated with everything. It's going to be associated with eating breakfast the next morning. It's going to be associated with brushing your teeth. But obviously, getting a vaccine didn't cause you to brush your teeth. Hopefully, it's because your mother told you you're supposed to brush your teeth every day. That's what causes you to go brush your teeth, and then you realize it's a good thing to do. But because something's associated, that is a signal. That thing with the VAERS, where I was talking about, if you see the signals, we're seeing a lot of things where people are reporting association. Then we look at it to see, is there a causation? And when they looked at a causation, which means by doing one thing, it causes the other, there was absolutely no causal relationship between measles vaccine and autism. And there's been multiple studies with that, with thimerosal, with aluminum. None of them have been associated with autism when you do this case control kind of a study I was mentioning.
Yeah. Well, so that kind of brings me to a sort of a related question, and it has to do with being in the office and being at the bedside, talking to a parent who may be a little bit on the fence about getting their child a particular vaccine, and they're open. They want to have the conversation with you as their physician. What have you found works in terms of helping people understand this very complex subject, but understand it, accurately, but in a very digestible way?
Well, Bruce, I think that one thing that you brought up, is the point kind of alluded to, is a very important thing as far as having a conversation, having a respectful conversation. And I very deeply believe that parents have the right, and with every expectation, to be able to gather information so they can make an informed decision. So asking questions to say, I'm hurt about this or I'm concerned about that, so that as physicians or healthcare people, we can provide the accurate information. But I think a lot of times is that what I'll start with, as far as tell me what it is that concerns you. What have you heard? What are you worried about? Because I want to make sure I'm understanding their concerns. And because everybody is no one's the same. They all have a little bit different reasons or concerns. And so to be respectful is to understand what's the concern of that person, and then to be able to direct your discussion at that point. And then, kind of like we're doing now, allow it to be a conversation. And it may be that it carries on to another visit or something, but that, parents want to do the right thing for their children. They want to do what's going to keep them healthy. They want to do what's going to keep them happy and have a long life. And we just need to provide them the information so they can understand why vaccines are so important.
Yeah. Well, I want to turn now to a vaccine that's not on Ohio's list of required vaccines, but I think it's a pretty important vaccine because it has, of course, all the vaccines I think are pretty important, but this one has a special role in that the data is becoming increasingly clear that it is very effective at preventing some pretty serious forms of cancer, and that is the HPV vaccine.
HPV?
Yeah. So when you're working with parents and their teens in your practice, why do you advise them to get this vaccine, and does it really make sense for all kids?
What you said is that all vaccines are important. I absolutely agree with that. I think if you were to say, where would I put HPV, I'd put it as very high to the top of the most important, because it prevents cancer.
Yeah.
Full stop.
Yeah.
And if you ask people, who of you know of someone that has cervical cancer or had uterine cancer or vaginal cancer, or head and neck cancer, almost everybody's going to know somebody, and
Yes.
most people know a lot of people. This vaccine basically can decrease cervical cancer by over 90%. The reason that we want to use it at an earlier age, and we don't exactly understand the reason of the immunology for this, but giving the vaccine at 9 years of age, you actually get a higher antibody response than if you give it at 15 or 16 years of age or so. So that's why we're using it at an earlier age, as far as that it gives a higher vaccine titer, which means that you're giving a higher level of protection that's going to last for a longer period of time. So that's really the medical reason of wanting to use it even as early as 9 years of age. It's can be done routinely up to 26 now, and even the CDC has made, or ACIP has made, some recommendations between 26 and 45 is to have this what's called shared decision making, is talking to your healthcare provider and say, do you think I still would have benefit from the vaccine? But one of the things that's clear is that the HPV vaccine does not change sexual practices, as far as it does not make kids sexually active. It doesn't make kids be more promiscuous or anything like that. It just keeps them from getting cancer. The other thing it works very well, incredibly well on, is venereal warts and genital warts. People don't talk about that a lot, but they can be very disfiguring. They can be very painful, and this vaccine almost 100% prevents them. So it prevents cancers in girls, it prevents cancers in boys or men and women. It's an incredibly important vaccine. The reason that we don't have it as a routine vaccine for school is because the vaccines we're having for school entry are diseases where it's easy to transmit in school. HPV is not one that's going to be transmitted in school, so that's why it really hasn't made the school required. But as far as for infectious diseases, a vaccine, this is incredibly important. It's very safe. It works very well, and that I would highly recommend it for every child.
Yeah, and I think I think you're absolutely right. People, I think, are not necessarily aware of just how commonplace HPV infection is in the course of people's lives, and that it's when you look at the numbers of HPV infections, to use the word ubiquitous would be very accurate. It's nearly
you're getting millions of people a year.
That's exactly right.
Yeah,
That's
millions.
right. About 13 million young Americans every year become infected with it, and it's so closely associated with a whole variety of cancers. So, I mean, to not protect yourself, to not, particularly when we're talking about a vaccine that's targeted towards young people, to not protect your adolescent or 9 or 10-year-old, it's hard to think of a reason that you would not want to shield them from cancer risk down the line. And, I think to some extent, we as a medical community early on when this vaccine was introduced may have missed an early opportunity to really focus like a laser on that cancer prevention. Because I think that we were so, as a medical community, grateful and enthusiastic just about even the more short-term benefits of the vaccine that you outlined as well. But I think the longer-term reduction in cancer risk is particularly compelling.
Yeah, I mean, one of the things is that it's a little frustrating to me as far as that if you look at our vaccination rate in adolescents in Ohio against whooping cough and against meningococcal infection, we're at about 85 to 90%. So we're doing very well with that. For HPV, we're about 60 some odd percent. So if the teens are in the office and they're getting the meningococcal vaccine, they're getting the Tdap vaccine, that means there's an opportunity for them to get the HPV vaccine. And sometimes I think what's happened is, as far as that, our messaging as physicians sometimes might not be the best, as far as that we really need to say we have these 3 vaccines, and if it's flu season, it's we really recommend a flu vaccine too, that everybody receives. But sometimes what parents have heard is that you need the Tdap, you need the meningococcal, and there's this HPV, and so it's not always interpreted as being an important vaccine versus saying we have 3 vaccines that we really recommend your child to get today. All of them are very important. All of them are very effective. All of them are very safe. And I highly recommend your child get all of them.
Yeah. Well said. Well, Bob, I want to thank you so much for joining me on this podcast. It was a brief conversation, but I think a really good one, and one that I really enjoyed, and especially knowing how busy you are as a practicing doc and a researcher. I want to thank you for being so generous with your time and expertise.
You're very welcome. I mean, this is part of our job as physicians, is giving out good information for parents so they can make the best decisions for their children.
And to everyone who will have tuned into this episode, I want to thank you as well. I hope it was time well spent. We're already planning for our next episode, and I look forward to sharing more public health information with you then.